Sometimes your doctor might not tell you that certain checkups are totally unnecessary after 70. Most people assume routine checkups are always good, but what if I told you that after 70, some of these routine screenings can quietly start doing more harm than good? That's not fear-mongering. That's the growing consensus among geriatric experts and physicians who are finally questioning the blanket testing protocols that often treat 75-year-old bodies like they're still 45. Because past a certain point, medicine isn't just about prevention anymore. It's about precision, and some of the most common screenings, ones you might feel guilty declining, can lead to unnecessary surgeries, false alarms, or long recoveries that rob you of the very quality of life you're trying to protect. Let's break down the checkups that may not be worth your time or your risk after 70. The colonoscopy trap. After 70. Colonoscopy has long been the poster child for preventive care, but after age 70, especially if you have no symptoms and no family history, it might be time to step off the scope carousel. Why? Because colonoscopies come with serious risks, especially for older adults. The prep alone can be brutal. Harsh laxatives, dehydration, electrolyte shifts, and disrupted sleep. That alone can cause falls, confusion, or even hospitalization. Then there's sedation. Older bodies process anesthesia differently. What leaves a 50-year-old groggy for a few hours can leave a 78-year-old disoriented for days. And here's the kicker. Many polyps found in seniors are so slow-growing they'd never cause harm in a typical lifespan. But once discovered, they set off a chain reaction. Repeat scopes, biopsies, even bowel surgeries. Not because you're sick, but because the system is wired to react. Take George, 82. Active, sharp, no symptoms. He agreed to a colonoscopy, just in case. The prep dehydrated him, the sedation left him woozy, and he fell that night, fracturing his hip. Months of rehab. The scope? It found nothing. There are safer, less invasive options now, like stool-based tests, FIT, or Cologuard, that can detect issues without dragging you into the deep end of risk. If you're over 70 and symptom-free, you have every right to ask, is this still worth it? The real question is, are we chasing a disease that won't arrive until we're 90, if ever? The full body scan fantasy. There's something seductive about the full body scan. It sounds like next-gen prevention, a high-tech scan that spots trouble before it starts. But for seniors, it's often a Trojan horse. CTs and MRIs are powerful tools, but that power cuts both ways. They're designed to find everything, including harmless anomalies that would never affect your health. These incidental findings set off alarm bells, nodules, cysts, shadows, and suddenly you're on a diagnostic merry-go-round. Biopsies, follow-ups, surgeries, not for illness, but for shadows on a screen. I met Betty, 78, at a health fair. She felt fine, walked daily. A mobile clinic offered a discounted full-body scan. It found a tiny lesion on her kidney. Harmless, probably congenital, but it triggered panic, a surgery, and months of post-op fatigue and complications. The lesion, benign. The body at 75 doesn't recover like it did at 40. And what's often sold as peace of mind becomes anxiety, cost, and trauma. Most of these scans aren't even covered by insurance. They're marketed as smart, proactive choices, but they often end up creating unnecessary pathways into invasive care. And worst of all, the emotional residue. Seniors often walk away with one new identity, someone with a thing in their body. It changes the way you think about yourself, even if that thing is harmless. A shadow on a scan shouldn't have the power to steal your peace. If you feel fine, live fine, and have no red flags, why go digging for shadows? Cardiac stress tests, overused, overtrusted. It's easy to understand why stress tests are popular. The heart feels sacred, our rhythm of life. Naturally, we want to check it. But if you're over 70 and have no cardiac symptoms, no chest pain, no shortness of breath, no unexplained fatigue, a stress test may do more harm than good. These tests often turn up false positives in older adults. That's because aging changes your arteries, your heart rhythms, your baseline. A stiff vessel or slight electrical quirk might not mean disease, but the machine can't tell. It just sees different, and that difference cascades: angiograms, catheterizations, stents, and in some cases, bypasses. Harold, 76, had no symptoms. A stress test at his annual checkup found something abnormal. 1 month later, he had a cardiac catheterization and a stent. Then came complications: blood thinners, triggered internal bleeding. Hospitalization followed. 3 months of recovery, all from a test he didn't need for a problem that wasn't urgent. Leading cardiologists now advise against routine stress tests in symptom-free seniors. They don't reduce heart attacks, they don't extend life, but they can steal energy, time, and clarity. Want to care for your heart? Walk, eat real food, laugh, sleep well, don't smoke, don't isolate, and don't let machines hijack your peace of mind. Real prevention is lived, not scanned, scoped, or wired up in a hospital hallway. The problem with one-size-fits-all screening. At the root of this issue is a mindset: more tests, or more care. But that's a relic of younger medicine. After 70, what matters most is not catching every hypothetical threat. It's protecting your independence, your cognition, your comfort. Medicine isn't just about spotting disease. It's about knowing when not to look. Because here's what no one tells you: once you enter the diagnostic spiral, it rarely stops. One scan leads to another. One just in case biopsy opens the door to surgery, complications, or a new medication with its own side effects. And here's where the math gets brutal. Many of these tests are chasing conditions with a 10 to 15-year horizon before symptoms ever emerge. If you're 77 with a clean record, the odds that a shadow on a screen will turn into something meaningful within your lifetime are slim. Yet each one pulls you further into a system that's not designed to back off. It's designed to act. You've earned the right to say no, not out of denial, but out of wisdom. Shifting from fear to discernment. This isn't a call to abandon care, it's a call to redefine it. The best care at 75 isn't the same as at 45. It's more about observation than intervention, more about listening to your body than chasing numbers on a chart, and more about living fully than fighting theoretical disease. Yes, if you have symptoms, fatigue, weight loss, pain, blood in your stool, by all means, investigate. But absent symptoms and with a clean history, restraint becomes a powerful form of care. We don't talk enough about medical harm by good intention. The impulse to act, to do something, to cover every base, it's deeply human. But after a certain age, overaction becomes the threat. You don't need to armor yourself with tests. You need to trust your intuition, your experience, and your right to ask, what's this really for? Growing older doesn't mean growing passive. It means growing selective. You've survived enough to know that not every offer is a gift. Some are traps wrapped in medical language and sold as obligation. At this stage, the most radical act might be saying no to a test that offers no meaningful return, because the real risk isn't always disease. Sometimes it's the distraction of being pulled into an endless loop of appointments, scans, and procedures that steal your time, your clarity, and your peace. Let me be clear, this isn't about rejecting doctors, it's about evolving with them. The best physicians now talk about shared decision-making, a model that respects your age, your goals, and your autonomy. You are not a passive patient. You are the CEO of your health. So next time your doctor suggests a routine checkup, ask the hard question: will this change anything, or will it just change the paperwork? And if this message hit home, if it gave you a new lens for your health, I invite you to like, subscribe, and share it with someone you care about. Your story, your voice, and your discernment are part of what's reshaping modern medicine into something wiser, kinder, and more human. Thanks for being here. Stay curious, stay grounded, and stay free.